Good evening, everyone. I am Michelle Marion, and I am a director for the Islamic Speakers Bureau of Arizona. Welcome to our discussion tonight. The Islamic Speakers Bureau of Arizona's Community Education Series aims to help our community members learn about issues, agencies, and programs that support and protect us. This series helps us to become better informed and engaged neighbors. Tonight, our guest is Dr. Iram Khan. Dr. Khan is an internal medicine physician who is working as a hospitalist in Scottsdale. She moved to Arizona 12 years ago after finishing residency in Chicago. Dr. Khan is married to an intensivist and has 3 children. She has been working with COVID-19 patients since the start of the pandemic and has seen the worst of the worst in inpatient settings. Due to her work in this area, she has been interviewed on local news channel as well as CNN. Thank you all for joining us this evening. Dr. Khan is here to answer your questions, so please dive right in and start asking either by raising your hand in Zoom or post your questions in the comments section. Welcome, Dr. Khan.
Thank you, Michelle. Good evening and assalamu alaikum, everyone. I'm honored to be here today to talk about a topic that's very near and dear to my heart. Like Michelle said, I work in an inpatient setting, so I usually see the worst cases. And the devastation that this disease has caused in the last year, we all know about it. And I've just seen it firsthand. And now with the vaccines availability, I feel that there is hope on the horizon if we all get together and go ahead and get vaccinated. So I would like to talk to you today about any of your concerns. I know it's something new. We are afraid, side effects, what's going to happen, so I totally get it. It's not easy. And as a layman, and I would love to explain it to you in layman terms and try to answer your questions. So yeah, like Michelle said, if you guys have any questions, please send them over and we'll have time at the end to go ahead and answer those, okay? So let's go ahead and get started. I'll just share a little presentation with you. Okay. So, all of us don't need an introduction to COVID-19. We all know way too much about it by now. But just to go over it briefly, COVID-19 or the coronavirus disease, which is caused by the SARS-CoV-2 virus, severe acute respiratory syndrome virus. The main spread of the disease is respiratory. It's mainly spread through coughing, sneezing, shouting, talking loudly, huffing, puffing. That's the main source of spread. Now, main symptoms, if you're lucky, would be just fever, cough, fatigue, muscle aches, diarrhea, loss of sense of smell and taste. But if you end up getting a severe disease, it can affect multiple systems in your body and unfortunately cause long-term morbidity and mortality. The important thing here is, though we have had this disease for a year now, that we do not have a cure. We have treatments, they work in some, they just don't work in others. And to be honest, after seeing so many patients, there's really no rhyme or reason to why it works in some and why not in others. Yeah, we have identified underlying conditions. We know some people who are more prone to it, but still, I might get a patient, a young patient, 30-year-old, no underlying condition that I think might do really well, but end up, getting worse and worse. So we just do not have a cure for it. And that's where the vaccines play a role. Now, why should we get vaccinated? Well, obviously, the first line is we do not have a treatment. So our main hope is prevention. Now, how do we prevent it? We've been trying to do this social distancing for the past year, And how long can we keep doing that? It's hard. We have to go back to schools. We have to go back to work. It's just, how long can we do that? That's where the vaccines come in. With the vaccine, we have hope of preventing the disease. We have had 2.8 million deaths around the world, which is way too many. Also, latest, although no one can say for sure, but more and more data is coming up, which shows this COVID-19 is not going away. It will most probably become an endemic like the flu. It will wax and wane, but it will probably not go away. We need to get our world back. We need to stop the lockdowns. We need to get our schools back, the kids back into school. And we need to develop herd immunity or population immunity. Now, the term herd immunity or population immunity is not a new concept. We are all very aware of the vaccines. That we're not new to the concept of vaccines. We know about all the childhood vaccines that we get. We have all received our polio vaccines, the MMR vaccines. Those have developed. That's why we were able to fight those diseases, because we were able to develop herd immunity. Now, the concept of herd immunity is to get enough people vaccinated that we stop the spread of the vaccine. How many do we have to get vaccinated to stop the spread of the vaccine? It depends. It's different for different diseases. Though virologists still haven't figured out an exact number for COVID-19, but it can range anywhere from 60 to 80% of the population. Now, right now in the US, we have vaccinated about 56 million people. That comes out to about 16.9%. So we still have a long way to go. Now, like I said, the concept of vaccines is not new to us. We have been vaccinating kids and adults for multiple diseases, and that's how we were able to eradicate a lot of these diseases, like smallpox. Luckily, and this is history in the making, because this is one of the fastest vaccine that came out. Now, of course, that is the reason why there's a lot of anxiety about it, but we'll talk about that some more too. So there are 3 vaccines that have now been approved to be used in the US. There are a couple of others in the pipeline, but we're just going to talk about the main 3 ones which are right now being used. It's the Pfizer, Moderna, and the Johnson & Johnson. Now, Pfizer and Moderna vaccines are very similar. They are a messenger RNA vaccine, and we'll talk again about that a little more, what exactly that means. Pfizer vaccine was approved on December 11th of last year. Right now, it's approved for ages 16 and above. So anyone above the age of 16 can get the vaccine taken. And it is 2 doses right now, which are 21 days apart. Now, the initial data from the trials that they did on the vaccine showed that it's effective 95%. But right now, since we're giving it in the real world, we're collecting more data. And right now, it seems it's about 91.3% effective. There's not much change in that number. And this is literally, for a vaccine, an amazing number. We usually strive for anything but 60 or above. And this is, 91 to 95%. Now, also, it is 100% effective against severe disease. Now, what does that exactly mean? Now, it means that if you get this vaccine, there is almost a 0 chance that you will get a severe disease and you end up in the hospital. So meaning that's what we're trying to protect, right? Hospitalization, the severe disease. So there's about 100% protection against that, which is just amazing for a vaccine. Now, though it's not been approved in kids yet, in the pediatric population, but they're running trials. And so far, the data we've collected seems that in the 12 to 15 age group, it's about 100% efficacy. Again, this is like amazing for a vaccine. The Pfizer vaccine is also effective against the B117, which is the European strain that, or the variant that we keep hearing about in the news, and the B1351 strain, which is the South African strain. The Moderna is again very similar to the Pfizer. It's a messenger RNA vaccine, got approved on December 18th of last year. There's a little difference in age group. It's approved for 18 and above. Again, 2 doses apart. This is 28 days or 4 weeks apart. And the efficacy is 94.5%. Again, very similar to the Pfizer vaccine. Now, Johnson & Johnson is slightly different. It is a viral vector vaccine, and I'll explain that in a little bit. It was the most recent one that was approved. It was approved on February 27th of this year. It is approved for ages 18 and above. Now, something that is different about this drug is this vaccine is that it's a single dose. So people who are apprehensive about getting 2 doses, this might work for them with just 1 dose. In overall effectiveness, it was found to be 66.3% effective, but in the US, it shows it's about 77.4% effective. But again, the main thing that what we want to prevent is severe disease. It's 100% effective against that. Now, all of these vaccines usually are fully effective 2 weeks after your last dose. So in the case of Pfizer and Moderna, it would be your second dose. But with Johnson & Johnson, it would be, 2 weeks after you get your dose, you have full immunity. This is just a little diagram explaining, and I'm going to explain in a very simple way of how these vaccines work, because there's a lot of apprehension about it, people thinking it will get into their DNA or change their DNA and stuff. So it has nothing to do with your own personal DNA. And I know people are scared, but our DNA changes every single day. There are every single day mutations happening in our DNA. I mean, I know I wouldn't mind some changes in my DNA, but this is not doing it. This vaccine is not. If you look at the left side of the screen, that's the viral vector, which is the Johnson & Johnson vaccine, and the right side is the messenger RNA vaccine, which is the Pfizer and Moderna. So the way the Pfizer and Moderna or the messenger RNA works is, it takes this message and it is coated around with a lipid nanoparticle. That is, now messenger RNA is a very unstable particle, so it will disintegrate. We needed some vessel to get it into our bodies, and that's what that lipid nanoparticle does. It gets it into our bodies and into our cells, and after that it will disintegrate. So if you look at it, you can see that kind of beige area is our cell, and if you can see the host cell, it says at the bottom, it's the host cell nucleus. So the messenger RNA vaccine, the Pfizer and Moderna, don't even enter your nucleus. That's in your nucleus is where the DNA is. So it's not even getting in contact with that. It comes into gets into your cells, and then it tells your ribosomes, which are little factories in our cells which make proteins. It tells these little factories to start making that spike protein. And I'm sure you've all heard in that first picture that I showed of the coronavirus, that those little spikes on it, we took that instructions for how to make that protein and put it in our own cells. Now, these factories go ahead and make that spike protein. Once it's made, that spike protein goes ahead and to the surface of the cell. Once it comes to the surface of the cell, our body, the immune system of our body recognizes that this is not something that belongs to its body. It starts creating antibodies to it and goes ahead and attacks those cells and kills them. That's where you get, when you get that vaccine and you have an injection site reaction where you get like that swelling and pain or a rash, that's a local reaction because of that. But at the same time, now your body has recognized that protein and it's developing that immunity. So next time you are around someone who exposes you to the coronavirus. Say it goes ahead, somebody sneezes around you, it enters your nasal passages, enters your body now knows that this is a foreign virus. It goes ahead and attacks it before it starts mutating. It's before it starts replicating and causing disease in our body. On the left side is that virus vector DNA. Again, the concept is the same, but it does the same through a little piece of DNA that it is injecting in a different virus called adenovirus. It causes common cold and stuff, but this is an inactive virus, cannot cause a cold in you, is just used as a vessel or a vector to help it enter our body. It's injected into the skin, goes and enters into the cells, but this one will go ahead and go to your nucleus, where it creates a messenger RNA that goes ahead and then again creates, it tells the ribosomes to create the spike protein. And again, the same process. I hope this is not too complicated, but think of it that it is these instructions, that vaccine is giving instructions to the body to make the spike protein, which is an inactive part of the virus. It does not cause disease. It's only the way that the virus attaches to cells in our body. So it will not harm us. We produce a small amount of that. Our body, the immune system recognizes that as a foreign protein and goes ahead and attacks it, makes us, antibodies, and that's how we develop our immunity. Now, what are the side effects of these vaccine? Obviously, I know everyone is, concerned about the side effects. Main side effects are, and we've seen these with other vaccines, so it's nothing that different. You'll have injection site pain, swelling, and redness, and can have a little bit. Some people have it more, some people have it less. Other more systemic symptoms can be fever, fatigue, body aches, headache, nausea. The fever in some people can go up to 104. Doesn't mean everyone has it. Usually, these reactions should occur within a week of the getting the injection. If you're getting symptoms after a week, that we want to make sure that you're getting checked out, that you're not sick with something else. It may not be just the vaccine. Most of these reactions are happening after the second shot. That is because our body had, with the Pfizer and Moderna, the first shot, our body's already made some immunity. After you get the second shot, now you get a more stronger immune response, and that's why you get more severe reactions to it. Now, there is a very small percentage who have had severe allergic reaction or anaphylaxis to the shot. It is still very rare. That is why after you get the vaccine, you have to stay at the facility for at least 15 minutes so they can monitor, because usually this reaction happens very quickly. So if you are having throat tightness, difficulty breathing, your heart beating fast, you want to make sure you let them know, and they will make sure that you're checked out if you're having an anaphylactic reaction. That would be when somebody would have a reaction to like a peanut allergy, when they would need an EpiPen. Again, those are the main reactions with Pfizer and Moderna. Johnson & Johnson, again, kind of very similar, pain, swelling, redness, injection site, and the fever, fatigue, body aches. But we've seen, again, it's newer too. We haven't given that many doses of Johnson & Johnson, but side effects are less common compared to the Pfizer and Moderna. So again, if you're concerned about that, maybe Johnson & Johnson is the way to go. It's a one shot, less reactions to it too. Now, what are the myths? And I hear this every day, and that's what I want to focus on. And it doesn't matter. I've heard it from doctors or people in the medical community and the non-medical community. So here, no question is wrong. If you have concerns, it's okay to ask. And I would rather we clear these out than you not get the vaccine. So vaccine can give you COVID-19. No, like we talked about, the vaccine does not have any virus in it. So you cannot get COVID-19. We're only making a spike protein, which does not give you disease. Vaccines can make you test positive for COVID-19. Again, false. You will not test positive after you receive a vaccine. There is what we're checking for the spike protein. When we do those tests, you're actually not going to have that in your body. Your body's already made immunity to it. That's it. And you don't have any more of that spike protein left. Vaccine can alter your DNA. So like I said before, there is no alteration of the DNA involved with this vaccine. There is no microchip we're putting into anyone. We're not altering a DNA. It is just a little message that goes into your body. And remember I said that messenger RNA, that particle is very, it's very unstable. So it disintegrates almost immediately. So it does not stay in your body for long. Vaccines contain live virus. Now, we are not, we are used to vaccine that have, live viruses or dead viruses, but this is not one of them. And again, this is, we've had those measles, mumps, rubella, polio, vaccine, flu. They all have, live attenuated viruses. So we have made vaccine in the past with that, but this is not the case. This is a new type of vaccine, and it does not contain any live virus, so you cannot get sick from it. Now, there was initially when the vaccine came out, there was a lot of concern about vaccine causing infertility, and that has been proven wrong, that it does not cause infertility. Now, one big concern that I hear all the time, people are like, they're using us as guinea pigs. How can this vaccine be safe since, they were so rushed, they're bound to make mistakes. Now, so here we want to clarify that these vaccines, although we got them really quick, and yes, this is probably once in history that's happened so quickly, they are still safe. Why? Because they still went through, we usually have 4 phases of clinical trials when we make a vaccine. They went through all those four phases. We did not, cut any of the phases shorter because we wanted to make these quicker. Now, why did we get it so quick? The reason is because we had all this technology from before. They had already been working on this messenger RNA vaccine for a long time and for other diseases and had the technology. Why did we not have a vaccine before? Because that, like I said, it's an unstable particle. How to get that into our bodies, they needed something to get it into our body. That nanoparticle, that lipoprotein was what we needed to get into our body, and which they made. Once that was made, they had the previous technology, they got them together, and there you go, we had a vaccine. Also, usually the vaccine development or production starts once the trials are completed, and and then it goes get through an FDA approval, and after that they start, production of the vaccine. In this case, since we were in the middle of a pandemic, they started the production while the trials were being run. So we were not sure if the vaccines were going to work, but we were at the same time still producing the vaccine just in case they worked. So we have enough vaccine, and that worked. They worked, and we had vaccines already present that we could start giving out immediately. Plus, they were prioritized by the CDC and FDA. Obviously, we're in the middle of a pandemic. The things that would usually take longer years, we try to get them done faster. So none of the safety precautions were skipped while these vaccines were made. Okay. Now, I'm going to just go ahead into more details about concerns that people have about it. I know we have 3 vaccines, and people ask us all the time, which vaccine should I get? So here's what I'm going to tell you. Don't get too tangled in the data, in the numbers, okay? There has been no head-to-head comparison or trial between these 3 vaccines. The data between the number of 91 to 95 to 66, this is, I wouldn't compare that, because these trials were done in different areas, different population, or different circumstances. That's why you get different results. What is important that all 3 of them are 100% effective against the disease, and the severe disease. That's what our goal is. When a vaccine is developed, the goal is that it prevents the severe disease, and we are getting that goal through it. So I would not go into details of that. I would just focus on whichever vaccine you can get is available in your area. Go ahead and get that vaccine. Okay. Now, and this question comes up all the time. I got my vaccine. Why do I still have to wear a mask? Okay. So again, I understand the concern. We're saying, oh, it's not going to cause the disease, then why do I have to wear a mask? Now, you have to remember, when this vaccine was being developed and the trials were being run, we were in the middle of a pandemic. Our goal was to prevent the disease and to try to do it as quickly as possible. They, at that time, were testing only for if the vaccine was effective against the disease, but not whether the vaccine was preventing asymptomatic infection or spread. Meaning, if I got the vaccine in the trial, they were checking me if I would get sick with symptoms, but they were not checking me on a regular basis if I still had, if I was exposed and I still got, COVID, in my body and my hairs, and could I just still pass it on to someone else? Now, since we do not have that data, it is still important to wear a mask so we do not pass it on to anyone else. Now, the good news is that as we are rolling these out in the real world, the vaccines, we're getting more and more data. We're still collecting data. So we are all now part of the trial in here. We're still collecting data, and it seems that most probably the people who are vaccinated cannot pass the disease. It's not 100% what we say, so most probably we'll soon get to a point where we may not have to wear masks. But right now, I would definitely say, if you are with people who are not vaccinated, if you're in a crowd, you should still social distance and wear a mask. Okay, now the next big question. I got my vaccine. Can I travel now? Well, trust me, everyone wants to do that. I want to do that too. The good news is CDC just recently announced that if you had your COVID vaccine, you can travel within the United States, any of the domestic flights, and you do not have to get tested for that, that gives you a lot of option. Now, if you're on an international trip, you don't have to get vaccinated, get a test before you get on a flight, unless the country you're going to requires it. But if you're coming back from a foreign country, you do need a negative test to get back on the plane. Once you get back into the United States, they want you to get another test done about 3 to 5 days later. And if that is negative, you do not have to quarantine after that. Now, should you be traveling? I think there are ways to do this safely, but with these new emerging strains that are coming out, you want to do this safely. You want to make sure you're not going to a place where right now there's a COVID-19 wave going on, or where there's a new strain going on. The chances are that you might get it and might bring it here. You may not get sick if you had the vaccine, possibly, but you may still pass it on to someone else. So you can still travel, but mask, stay away from crowds, keep your distance, do it intelligently. Okay, and again, I got my vaccine. Now, can I meet my friends now? Okay, so good news about that too. CDC now says that if there are 2 or more vaccinated people, can meet even indoors without masks. So the chances of vaccinated people passing on the COVID-19 is very, very low. So now we say that you can meet with people who are vaccinated. Now, you still have to keep in mind, are those people you're meeting, are they staying with, they have some other family members who are not vaccinated and who are immunocompromised, high risk for, the COVID-19. You want to be careful with that, so you do not pass it on. Remember, our kids are still not vaccinated, so if you have kids, you want to be careful with that too. But as far as vaccinated people go, it is safe to meet without masks indoors. But I would still try, while we're still trying to vaccinate more people, bring our numbers down, try to get a hold of these new variants, try to stay away from very large gatherings. Okay. Let's see. Now, this is an important one that I hear all the time that, oh, I've had COVID-19 already. Why do I still need a vaccine? So yes, you do. And this is why. When you get COVID-19, the immunity that you develop, we're still studying that. It is variable. Now, you might, if you had a mild disease, you might only have a mild antibody response or not developed enough immunity to it. There is two types of immunity. It's antibody and our T cells. There's not a good way to measure our T cells. So we just don't know if you have immunity to that or not, the disease or not. So the only time if you have COVID-19, if while you're in the infectious stage, which at that time you should not be going out of the house anyway, you should be quarantined. While you are in the infectious stage, do not get the COVID-19 vaccine. But once you're out of the COVID, once you've recovered, go ahead and get it. Do not wait. You do not have to wait that 3 months. Initially, they had said, you can wait for 3 months because they were trying to make that vaccine available to other people who needed more. Now I think we have more doses available. If you had COVID-19 and you have recovered, go ahead and go get your vaccine. Now, there are two conditions in which you would still wait the 3-month period, and that would be if you had severe disease enough that you were hospitalized and you needed and you were given by your doctors the convalescent plasma. That is the plasma that we give that we take from patients who have recovered from COVID. It's one of our treatment for COVID-19. We give patients the plasma of recovered COVID-19 patients, which already has antibodies to these patients, so that can help them fight the disease. So if you got the plasma, or if you got the monoclonal antibodies, which a lot of people now call that Trump treatment because Trump got those antibodies. Those are usually given in an outpatient setting. There's usually a strict criteria. It's mostly for older patients who have underlying conditions. But if you are one of those patients who got sick and got the monoclonal antibodies, then you need to wait 90 days before your vaccine. And that is because those monoclonal antibodies and the plasma antibodies would interfere with your own antibody production. So we usually recommend that you wait for that for 90 days, but after that, you can go ahead and get the vaccine. Okay, this is another one that people talk about. Isn't it better to get just natural immunity and, by getting the disease? A lot of people say, most young people don't get severe disease. I'm young, I'm healthy, I don't have underlying conditions. Why can't I just, get COVID-19 and, I'll just recover and then I'll have immunity? So, a bunch of factors to that. First of all, you don't know if you're going to get, a mild disease, because I've treated patients in their 20s, in their 30s, in their 40s, that no underlying conditions, but got severe disease, ended up on a ventilator. You do not want to be that person. So you don't know if you will develop, by getting the disease, are you going to, getting a mild disease, or are you going to get a severe disease? Secondly, again, like I just talked about, we don't know within, mild disease or, how much is your immunity, how long does it last? Because there are already reports of people who have had COVID-19 once and got sick with it again. So we just don't know if that immunity lasts too long. The next, of course, the obvious is that if you get the disease, you're going to pass it on to your friends, your family. Do you really want to take that risk? And then, last but not the least, which it bothers me a lot, is those, long-term side effects from it. We have all heard about the COVID-19 long haulers. These people who have this fatigue and shortness of breath months and months out when they got infected. So we don't know. This is a disease. This is science in the making. We're just learning as we go. We don't know how what are the long-term effects of this. Do you really want to get the chance of this getting this disease? So I would never take the chance of doing that. I would definitely recommend that you go ahead and get the vaccine. Now, this is a very important question. How long will the immunity from the vaccine last? I know there's a lot of time where a lot of the doctors and we keep saying we're not sure, we don't know, because you have to understand this is a new disease. I went to med school, but I didn't learn about COVID-19. There was no COVID-19. This just started in the last year, so we are just learning as we go. We're learning as we go about what the disease does, what are the long-term effects, what devastation it causes in the body, and we're learning about these vaccines and how long they're going to last and how much immunity can they provide. So right now, since the Pfizer and Moderna were rolled out, we have about 6 months of data, and the immunity is lasting for 6 months. So that's good news. We're good for 6 months, and we're going to keep studying it, and hopefully it lasts longer than 6 months, but we know that it does last minimum of 6 months. Okay, so again, although I say we don't know, but we're hopeful that it lasts way longer than 6 months. Will we need yearly booster doses? So again, it's a loaded question, and maybe not. As I said, we're still learning about the disease. If we see that the immunity starts dwindling down after a year, or new strains come up that the original vaccine is not active against, we might need to do yearly booster doses, like how we do for flu vaccines, a yearly dose, but we don't know yet. I still think it's not a bad trade-off. If we fight a pandemic by doing a yearly booster dose, it gives me an immunity, why not? Okay, so this may not apply to everyone, but I know a lot of people have this question: can pregnant or breastfeeding women get the vaccine? Now, pregnant and breastfeeding women were not included in the trials, but from what we understand about the vaccine, there does not seem to be any contraindication that pregnant or breastfeeding women should not get it, or that this vaccine might cause harm to the baby. So while you should, of course, always discuss this with your doctor, and it should be a case-by-case basis, I personally know a lot of people who have been pregnant and breastfeeding and got the vaccine and have been doing just fine. Okay, so who should not get the vaccine? Now, this is obviously important because we've been talking about that everyone should get the vaccine, but who should not get it? There's not a lot of people that I think should not get it. First is obviously the people who have an allergy to one of the components of the vaccine. One that we have seen is the polyethylene glycol that people do have an allergy to, and that's what may have caused the anaphylactic reactions in people. So if you are allergic to any of those components that are included in the vaccine, you should obviously not get the vaccine. The next would be obviously the pediatric population, because we have just not completed our trials in them. So right now it's only for 16 and above. We are still doing studies on the younger kids, and once we get data, hopefully they should be able to get vaccinated too, but not right now. I talked about people who got either convalescent plasma or monoclonal antibodies. That's a relative contraindication for only 3 months. So not that they should never get the vaccine, they should just wait for a 3-month period and then get the vaccine. Obviously, if you have active COVID-19 disease right now, if you are sick with it, you should not get the vaccine. You should wait till you are better. So usually we want you to wait that 7 to 10 day period when you are not in the infectious range. But once that is over, you can still go ahead and get the vaccine. Another relative contraindication is if you have received another vaccine in the past 2-week period. So if somebody's got a flu vaccine or a shingle vaccine or a pneumonia vaccine, we usually want you to wait for 2 weeks before getting the COVID-19 vaccine. Or if you got a COVID-19 vaccine first, then you should wait 2 weeks before you get the other vaccines. It's just that because we haven't studied it, we don't know exactly if you take two, what type of immune response it might cause. We don't know if it would cause a bad response, but right now, just out of an abundance of caution, we would say that you should not get that vaccine. Okay, so I know a lot of people might have asked this question about if I am vaccinated or, what I recommend to my family. So yes, I am vaccinated. My husband's vaccinated, and it was our privilege as physicians to be one of the first to get vaccinated. So yes, I definitely believe in it, and I got it for myself. I have a 16-year-old son, and I'm right now looking for an opening anywhere that I can get to get him vaccinated. So as soon as we find a spot, we'll get him vaccinated. I have an 11-year-old who's going to be turning 12 in May, and hopefully, if by the end of the summer the vaccines are, approved for pediatric population, I will definitely be getting her vaccinated. My siblings are vaccinated. My parents are vaccinated. So this, I am not just saying this to you. It is something that I truly, strongly believe in, and that's why I am recommending it. So, I know there's a lot of, like I said, I totally understand the concerns around it. This is so new that we obviously are concerned. There are a lot of conspiracy theories out there. So I'm not going to go focus on those, but I'll tell you what, I can just read science, right? I will tell you whether this disease was manufactured, was natural. I don't know, and I don't care. I know it is real because I've seen it. I've treated those patients, and it is the worst thing to die when you are hungering for air. I don't know how I can tell you that. It just, no matter how many patients I see with that, it just doesn't get better. So this is just bigger than you and me. It involves the whole world. This is history in the making. We need to make a choice on which side we're going to land on. Every single person who chooses to get the vaccine, wears a mask, socially distances, is helping the biggest pandemic of our time to end. This is something we're going to talk to our grandkids about. What are you going to tell them? What did you do for this to end this pandemic? Thank you very much. That's all. If you guys have any questions, I will wait here. Let me take the screen off, see if I can answer any questions now. I don't know if you got any on Facebook, Joe. No.
Sorry, you guys didn't hear me. No Facebook questions, but I do have a question. Some believe we get herd immunity by June. Will that mean that our lives will get back to normal by summer?
So that's the hope, right? Like I said, right now, 16.9% of population is, immunized. If we go ahead and go, it seems like the vaccines are coming out, but if people start getting it, yes, I'm hoping so. I heard the same, and I hope that we will. And I had concerns about the variants, but seems, that the vaccine now, with the variants also, I think I didn't talk about this. The variants, we have to understand that they are still the same strain of the virus. There's just a little bit of genetic change in there. So the vaccines do work. It may not work the same efficacy, but it's not like it's not going to work at all against these. So, but if we get something very different, or like how they're talking about more virulent, more, causing higher mortality, maybe we'll need some booster doses to help with that. But right now, it does seem if we get enough people vaccinated, we might get there. See, which I think we're getting the Israel data, who have vaccinated a big amount of their population, and their numbers are all dwindling down. So possibly. I see some questions in the chat. Let's see.
So Imran, I'll moderate if that would be helpful.
Sure, go ahead.
And I've done this before. So one of our guests asks, what is the percentage of the population that needs to be immunized to achieve the herd immunity?
So, that is not a number that anyone's 100% agreed on. And it is, again, I say this, and I know it sounds like, we keep saying we don't know, but, it is because it's a new disease and we're learning about it. The herd immunity for every disease is different. It depends on the virus, the virulence, so it is different. It can be anywhere from 60 to 80%. So even if we get the lowest number of that, which is 60%, if we are at 16.9% right now, we still have a long way to go.
Okay. All right. Thank you. Yeah. I think that's really helpful for us to try to understand around 70.
Yes.
And another of our guests is asking if I'm vaccinated and I travel by airplane to check on my relatives who are also vaccinated, but over the age of 65 and immunocompromised, do I quarantine outside of their home or am I allowed to stay with them? Also, do I wear a mask at their home or is that not necessary? What kind of specific instructions would you give to a patient in this situation?
So, you will not have to quarantine right now. We're not saying that you need to quarantine now. Unfortunately, if they are immunocompromised and high risk, that does pose a little extra risk. Now, in a normal situation, you would not have to quarantine. But in this case, I would say when you are in a plane, you want to make sure that you are masking the whole time, and that is not taking the mask off for eating or drinking on the plane. So you are vaccinated. Unfortunately, it's very hard. You can't distance on an airplane, but you want to keep that mask on so you are minimizing that picking up that virus from anyone. And while you are with these, since they are immunocompromised people, I would recommend that you keep the mask on. You don't want to get these people sick then.
Yeah. Thank you so very much. And another question, one of our guests says, great presentation. And then she follows up with a question, how much preventive measures should vaccinated parents of unvaccinated minors practice? So, and you're in that same situation with your children.
Yes. So, you need to follow the same CDC guidelines. So, yes, you can meet with other couples who are vaccinated, and it's okay to do it without masks on or indoors. But you want to you want to avoid larger gatherings. If you're going out otherwise, you want to make sure that you're if you're in a store or somewhere, you want to make sure you're keeping that mask on, because yes, you have those kids at home and there might be a small chance that you can still, again, like I said, we're finding more and more data that vaccinated people are most probably not passing this on, but until we're 100% sure, we want to make sure that we don't pass it on to our kids. So I'll give you an example. Like you said, my kids, I have 3 kids, and obviously, me and my husband's an intensivist, so we both are seeing these COVID patients. I keep my mask on, and I know in the hospital I have this. For me, it's unavoidable. Obviously, I have to. My patients are old; they're on oxygen. They can't hear me. I'm literally in their face the whole time. So, but keeping that mask on, even before the vaccination, and I know we have the medical grade, masks and stuff, but that prevented me while seeing these patients every single day, and my husband, we were lucky enough not to get the disease. And I think these were just from being smart, keeping that mask on all the time. And then I would keep it on with the non-COVID patients around nurses and stuff that I did not know if they were exposed or sick. So we've been, by keeping that mask on, we have kind of escaped that disease so far. So don't forget about that mask. It's a simple thing. It's the simplest thing, right? Just keep it on. I feel like I'm so used to it now. Now, if I don't have it, I feel kind of weirded out. So just keep that mask on till we get more information, and keeping our fingers crossed. We all want to get back to that world with no mask and no restriction, and hopefully we'll get there.
Yes, I think we can all agree with you on that. And another one of our guests has a question. Would you be able to review the current CDC guidelines for gatherings, because I know they're changing almost by the week?
Yeah, so the latest ones are the same that I said, for vaccinated people can meet with each other indoors without masks on, but we're still recommending that you avoid large gatherings. And if you're out, you're keeping your 6-foot distance. So for vaccinated people, that's what I'm saying. If you want to go back to that world, get vaccinated, man. Get vaccinated. You can meet your friends tomorrow. You can meet them, indoors without a mask. Before we were recommending you do outdoors. Now we're okay with the indoors too. So that's the best information we have. The larger gatherings, we still want to be careful with those, because there's still a chance that somebody there is exposed and can pass it on to others. So we want to avoid the larger gatherings, smaller gatherings. Vaccinated people indoors without masks are okay.
Okay, wonderful. Absolutely wonderful. And a follow-up question from our same guest. If I can't get a vaccine in my state, can I receive it in a neighboring state if they have appointments? And will I be turned away if I don't have that state's ID?
So as far as I know, I don't think so. Again, I'm not an expert on that. I can't say 100%, but from what I understand, nobody is to be turned away from a vaccine. Whether they should not ask for citizenship. They should not ask for, whether you live there or not. They should not ask, technically, if you don't have insurance, they do ask for insurance information if the insurance are allowed, but you can still get the vaccine. They are not allowed to charge you for that there. So from what I understand, you should be able to get it, but you might have to check it with your state regulations.
Okay, all right, excellent. Thank you so much. And another of our guests has asked, after the second dose, should we go about with our lives or still practice safety measures?
So you get immunity 2 weeks after, your second dose. My mom asked me that. She was like, after her second dose, can I go to the mall? And I'm like, not yet. So, but you have to wait 2 weeks because your immunity takes that long to get, your full immune response. After that, now going back to normal, this is a pandemic. There's no going back to normal right now. You can get back to a lot of the activities before that you were not doing. Like, my parents, we had locked them up in the house, not letting them go anywhere. We were scared for them. But now, I feel more comfortable if they want to go to a store, and as long as, they still mask, obviously, we can meet with them, and I feel okay with that. So yes, if you're, vaccinated, you can go back to a lot of the activities. I would still recommend avoiding those crowds, not meeting with people that, you think go out all the time, who might be exposed. Probably be more careful for people who are immunocompromised. We just don't want to get other people sick. That's the whole point of this, learning point from is don't think of yourself. You want to think of the other person too, right?
Yes, and it truly goes back to we're all in this together, and it's not, it is a collective effort here. And I have this same question, one of our guests posed, why do some of the vaccine pods request insurance information?
So, they can request the information. From what I understand, they are not supposed to charge you though for it. If you cannot, I don't know if I can give you a perfect answer for that. Which areas I know when I signed up, they did ask me for the insurance information too. So they are technically not supposed to turn anyone around if they don't have the insurance. I don't have the perfect answer. I can research that and find out which places are asking and how do you get around it, but I'm not 100% sure on that.
Okay, all right, well, thank you so much. And then we have one additional question, and then I'll also share some of the lovely comments about your presentation. But the last question, have you had any patients who were infected after being vaccinated?
So I personally have not. Now, remember, our Arizona cases are really, really low right at this time. I have probably not seen a COVID patient. My last patient was just like maybe a couple of weeks ago. So since the vaccine rollout is pretty recent. I have seen patients after first dose, but have not personally seen anyone after the second dose. I have read about some people, getting sick after the second dose. Again, since I have not personally seen them, I can't 100% say now, if you got your vaccine second dose today and then tomorrow you are test positive for COVID-19, that means you were already exposed and infected before you got the vaccine. So we can call this a vaccine failure. So I am not 100%. There might be reports of it. Again, like I said, so far, I do not personally know of anyone who has gotten the vaccine and gotten sick enough to be hospitalized. Remember, our goal was severe disease prevention. So if we are preventing these patients from ending up in the hospital, that is what our goal was, and we have achieved the goal, which we see in these nursing home studies, that the cases were so high since the vaccination, they've gone down to zero, those nursing home cases, but that means that this vaccine is working.
Yeah, excellent. Thank you. And I have seen a little bit of that too, and it was never really qualified with all of the specifics. So thank you for providing those specifics. And then we have some wonderful comments from some of our guests. I have no questions, but Dr. Khan, I want to thank you for a very good presentation, providing us with excellent information. And thank you for your dedication and service on the front line during this past COVID year. Again, thank you for a wonderful presentation. And this has been exceptionally valuable, I think, for all of us to be able to have those specifics, and then also to be able to share with you our appreciation for what you have done in this past year. And I can't even imagine what your day-to-day life must have been like. So thank you on behalf of all of us.
Thank you so much, Michelle. I just wanted to say one thing. I know I didn't include this in the presentation because, though I'm in Arizona, but I thought that, people all over the world are watching this. So I did not include the information from where you can get vaccines right now or how you can register in Arizona. But if somebody is having trouble with that, we can definitely help with that and provide that information, on our ISBA website. I'm kind of assuming everyone knows about that now. And again, everyone has to just reach out to their own state's website. But if anyone is having any issues in Arizona, then we can definitely help out. I know right now, I think December 9th, 10th, just one of my friends had just posted that one of the Islamic Center is going to give out the Johnson & Johnson. So we can probably put that information out there if anyone needs it and go ahead and get that vaccine, because that is the whole goal of this presentation, is to get everyone vaccinated. We need to end this pandemic. We cannot wait longer than that. Once we get vaccinated, we go back to our lives, and all of us want that.
Yes. Yeah. And having it'll be a different normal.
Yes,
than what we had a year ago. So yeah, it will be definitely a different.
I'm that person I'm that 5-second rule person, pick up from the floor and eat it type of person. Things have changed, so I don't know if we're going to go back to that normal, but yes, hopefully some form of normality.
Yes, definitely. So, and we have many other thank yous for such a wonderful presentation. And we really appreciate your time tonight. And I also want to thank all of our guests who were able to join us this evening. Please help us to bring more programs like the one you've experienced tonight. Consider donating generously to the Islamic Speakers Bureau of Arizona, and also follow the Islamic Speakers Bureau of Arizona on Facebook, Instagram, and Twitter, or you can visit our website to stay up to date on our upcoming programs. So we hope to see you again very, very soon, and we want to wish you all to stay safe and healthy and have a wonderful evening. So thank you again, Dr. Khan. We really appreciate it.
Okay, take care. Bye-bye.